Urbanized regions of the country are finally starting to see a decrease in COVID cases, and also hospitalizations. More like rural areas like West Virginia are still experiencing some of their worst metrics of the entire pandemic. WDVM's Roshan Davis has more on what solutions the Mountain State leaders are considering.
Although, according to state data, less than 40% of eligible West Virginians have received a booster dose, state health officials are looking into the possibility of an additional booster.
So far, Governor Jim Justice's COVID team hasn't heard back from the federal government regarding their request for approval of second doses. But would another shot even help control West Virginia's surge? Dr. Clay Marsh looked towards a country that's already begun its rollout of the fourth vaccine for possible answers.
In Israel, what they saw was, and this has also been seen in the UK, I believe, that the boosters are not sufficient to stop the spread of the Omicron variant, given its highly infectious nature.
Marsh says that the question of whether a second dose is useful is still on the table, as we wait to see if the shot gives the same protection against severe sickness as the first booster dose.
Vaccine effectiveness against emergency room and urgent care visits for those who received their primary series was 76% at 6 months after receiving the second shot. Following a third shot, vaccine effectiveness increased up to 94%.
But even if the extra shot is approved, residents still have to take it. We asked our viewers if they're open to the idea of taking another vaccine, and around 55% of respondents say they would get another dose if offered, while only 32% rejected the idea.
Currently, the governor's team says the state of West Virginia is still dealing with a shortage of antibody treatments, so that issue may be taking priority over an additional booster shot for the time being. Reporting in Berkeley County, I'm Roshan Davis for WDVM 25.